In this crossover episode from a podcast called Mom, You're Grounded, hosted by Allison and Jennifer, two professionals who work with seniors during the day and are actually sandwich generation caregivers for their parents. We talked about a new Medicare program called GUIDE, which stands for Guiding an Improved Dementia Experience. This is something that I have been working hard on professionally in my day job over the past 2 years. I hope you enjoy learning more about this program through my conversation with Jennifer and Allison. Hope you enjoy.
Again, just thank you for taking your time to come in and speak with us.
Yeah, we're so happy to have you here. We wanted to bring this conversation forward because we know caregiving isn't talked about enough, and there's exhaustion, there's guilt, there's hope, and it all matters. And we just really wanted to unpack what the GUIDE program offers and what caregivers can do to find that balance again. So we're so glad to have you here. So
thank you.
Yeah.
Thank you for having me.
Yeah. So kind of tell us a little bit about you and your background and how you got here.
Yeah. So I'm Mia Yang. I am a geriatrician, and that means I'm an internist with expert training in the care of older adults. Specifically, I'm a memory specialist, and I have been at Wake Forest, Atrium Health Wake Forest, for the past 9 years, but actually transitioned over the summer to the Charlotte part of Atrium, but still do memory care and all memory related projects. Specifically for GUIDE, which is an abbreviation called Guiding an Improved Dementia Experience. This is a program that was released by the Medicare Innovation Center back in 2023. At that time, I had just finished a large clinical trial comparing two different models of dementia care. That was a research study, and when GUIDE came out, it was sort of the perfect timing to apply for GUIDE, which is an alternative payment model for dementia care.
Okay.
And what that means is that typically when you go see your doctor, every visit you get charged a fee, and that's called fee for service. But a lot of the things are not entirely covered by typical charges, are things like conversation with social workers or connections and coordination with community services. And certainly it's oftentimes a big surprise to families to find out that Medicare actually does not pay for 4 hours of in-home care. If your mom or your loved one needs someone to sit with her for a couple hours at home, Medicare does not pay for that.
Oh, wow.
And so GUIDE is a innovation model that builds on probably about actually 2 decades of research of many different types of dementia care model. Typically, these are all comprehensive, meaning it touches upon not only the person living with dementia, but their care partner or caregiver as well. And it provides what I call medical psychosocial services. So it manages the medical issues related to dementia and co-occurring conditions. It manages the psychological needs of both the person living with the disease and their caregivers. And then it manages the social services and connections and support that people need as they go through this journey.
Wow. So I was so excited when Jennifer brought this idea to the podcast and was kind of telling me about GUIDE. I'd never heard of it, and I think it's such a great thing that we have here. So you've kind of explained what it is. So how does it differ from other caregiver support models?
Yeah, this is the first way. This is the first program within Medicare that kind of packages everything having to do with dementia caregiving into one package.
Okay.
So instead of going to see a social worker and a nurse practitioner for your dementia and getting charged or not charged separately, this is a bundled payment on a per member per month basis. So when guide teams have the flexibility of using that, they can use a whole multidisciplinary team to help support the family, because typically many social workers cannot actually bill Medicare for their services unless they were providing individual psychotherapy or counseling services. So the other big difference between Guide and other care models is that it has a annual cap of about $2,500 that can be used to pay for respite care.
Oh, nice.
And that the Guide program itself is supposed to set up the contract with at least home care organizations in the community, but may also be able to provide connections to adult day center. So instead of the family paying out of pocket for this type of care, each family that is eligible for this respite has about a $2,500 annual cap that can go towards their respite payment. A lot of times I see people who are too rich for qualify for Medicaid, but are not making enough to pay for, say, the $30 an hour of in-home care.
Yeah, because that eats up really quick.
Very quickly.
I feel like a lot of people fall in that category.
Yeah,
It
A
seems
lot.
like.
The majority.
Yes.
The majority
Yeah.
fall in that category. So $2,500 is not a whole lot of money. It's not going to be able to do all of the care that someone needs, but it is better than nothing.
It's a huge support.
Yeah, and compared to some of the other programs, specifically, I'm just thinking about, because we're in North Carolina, there is a statewide program called Project Care, which is caregivers running on empty. They have a small voucher for respite that is only $500, and you can only get that once, versus the $2,500.
Like once entirely.
Yeah, versus Guide, the $2,500 basically renewals every year for however long you're in the program.
That's amazing.
Yeah. So you mentioned like the adult daycare and options. So that $2,500 could go towards that, because I know a lot of people. Well, I have a personal experience. My uncle was diagnosed with early onset dementia when he was about 58, and my aunt was working full time. She's actually a RN at Baptist in the hospital, so she was working full time, and he progressed to where she would take him to the adult daycare. But a lot of people don't know that's even an option, or that how you get paid for that if your insurance covers it or anything like that. So
yeah, typically insurances do not cover for adult day, although I'm a huge fan of adult day programs. They're much more than just babysitting your loved ones.
It's engagement.
It
it's
is socialization, engagement, physical exercise. There's actually research that shows that people who are in a stimulated environment like that stay stable in their memory longer than sitting in front of the TV watching that all day.
Yeah.
It doesn't take a neuroscientist to know that sitting in front of the TV watching it
Probably
all day
not.
is probably
Yeah.
not good for your brain.
Yep.
But yes, so CMS, Medicare has pretty specific rules about how much you can charge per hour for in-home care and per day for adult day under Guide, and those are all basically already set up by the Guide delivery organization. So for example, in Winston-Salem, that's you actually have multiple options, not just Atrium Health, Wake Forest Baptist, but Trellis is a new program starting this year. AuthoriCare in Greensboro started last year, and then Hospice of the Piedmont, which is in High Point. So for people in Forsyth County, we're really quite blessed to have multiple options. The key difference among different programs is that Medicare has specific rules about what needs to be included in the Guide program, but it does not specify who does the work. So different Guide programs may be organized differently into more of a care coordination navigation service versus a more of a medical model. And and different ways of organizing the team. For Atrium specifically, because I'm the one who helped develop our program, we have everyone see a trained and experienced nurse practitioner or physician assistant in addition to a social worker as part of their comprehensive assessment. And then based on their complexity, we assign the navigator. It could be an APP or a nurse practitioner or physician assistant, or it could be the social worker. Or if you're doing great, then we might have someone who's not a licensed person but can check in with you on a monthly basis to see how you're doing, whether the caregiver is getting the caregiving education that we're sending them.
And if they're further with their progression, do they have more frequent visits from their nurse practitioner, or?
I think it really depends on the medical need. So as the disease progresses, oftentimes there are more behaviors associated with dementia. And so in some of the other programs, I think one question to ask is, how accessible it is to get to a prescribing provider who can potentially change medications. I find that the more teams you have, sometimes the coordination and the communication between teams may be challenging.
That's what I was wondering.
Having someone who is not able to adjust medications can put more on your existing doctors to make those changes, which sometimes they are comfortable doing and other times they're not. So that is to say that while medication management is a required component of GUIDE, depending on how the team is set up, there could be some differences.
So let's just say I know I have actually a really close friend that's going through this right now. Her mother was showing early signs of memory loss and dementia, and so they made the first step, made an appointment with her doctor, and then getting a referral, I think, to a I guess that would be
neurologist.
So kind of walk through the process for somebody that is caregiving and they're starting to notice maybe these signs in their parent, and then what would be like the steps to go through and then to be able to get GUIDE.
So GUIDE is something that does not require a referral.
Okay.
So this is a program where patients and families can call up the GUIDE program in their area and ask if they're eligible.
So they the diagnoses.
So they have to have a dementia diagnosis of some kind, and it could be more than Alzheimer's. But the GUIDE programs oftentimes also have a way of diagnosing people as long as it is not a surprise to the family. We don't necessarily, the program is not created to diagnose dementia, but it's really to manage dementia. But if people are having difficulty getting a diagnosis, but the patient knows it, their family knows it, even their primary care knows it, but they just don't want to write it in their chart that they have dementia, and that is something that GUIDE can do to certify, because we have to certify that someone has a dementia diagnosis for them to be eligible. The other major limitation is that you have to have traditional Medicare. So Medicare Advantage programs, the ones that are, you hear on commercials and billboards like from Humana, Aetna, Blue Cross Blue Shield, United Healthcare, unfortunately, those patients are not eligible for GUIDE.
Okay.
And that's because this is a program run out of the Medicare Innovation Center, and they only have control over these traditional Medicare patients. So for the folks in North Carolina, we have over half of people who are in Medicare Advantage plans, and that is a major limitation.
So because right now is the time when people are picking their plans.
Yes.
So what would you say to a family that are exhibiting these signs and they're starting to look for these different plans? Like, do they just go to their broker and talk to them about the diagnosis and their plan, like create a plan that will facilitate that? Like how do they know?
Yeah, so I think as of currently, there are no Medicare Advantage plans that offer a program similar to GUIDE. There may be Medicare Advantage programs who say, or list in their list of benefits that, you might be able to get some additional help in the home, but from all practical purposes, it's actually very difficult to get those services in the home. For example, I have a patient who I took care of, who I won't name the company they have, but the family actually showed me a beneficiary packet that describes their list of services. And in it, it looked like they could send someone into the home. But when I asked her to contact her insurance company, she got the turnaround, and we could never figure out if there's a form, if there's something that I could fill out to help her get that help, because she really needed the help. So I would just say that brokers typically sometimes are affiliated with certain insurances, so you want to be careful who you're getting information from. There is a non-biased source called SHIP. It's the Senior Health Insurance Plan program, which you can call the folks who are at SHIP and get a more neutral description of what the plans offer. I think the biggest difference between Medicare, traditional Medicare, and Medicare Advantage is that oftentimes it can be more expensive to pay for Medicare and get a supplement that covers the other 20% that Medicare does not cover, in contrast to paying one combined bundled payment to a Medicare Advantage plan. But the downside is that a lot of Medicare Advantage plans really restrict who you can get services from, and sometimes that can be in a way that's very impacting your care at home. So there are certain plans, again, I won't name which one, that doesn't pay for home health, and so it's very difficult to get some of those patients the services they need in the home, even if as a doctor
Which ultimately, if they had the services, they'd be safer at home. They'd stay at home a lot longer.
Right. So,
and even as a medical doctor, if you say they need that, you still can't.
The companies won't get paid for that insurance, and so I don't blame them for not wanting to take on those clients. You know, I'm not asking people to do free work, but that's the part of the challenge with these plans, is that if you're able to afford traditional Medicare as a geriatrician, my recommendation to my family and my friends is to stick with traditional Medicare, because you'll get the broadest coverage. Everybody takes traditional Medicare.
The Part D is all included in that one?
No, those are all separate. Yeah, so with traditional Medicare, you basically have to get 3 different parts from the government directly. One is your Part A and B. One is your supplement, which might be through a different company. And then you have to get Part D, which is the drug coverage, separately. So the benefit of Medicare Advantage, which is actually called Medicare Part C, they kind of group all of that together, which can be logistically easier, but then you have the downside of having less choice.
Not getting things covered.
Not getting as much choice.
Gotcha.
Yeah.
So when did Guide start? When did you create?
So I did not create the program, but
when was it created?
Start? Yeah, so there are about 390, or maybe slightly less than that now, 370 programs around the country that apply for Guide in 2023 and were approved by the Medicare Innovation Center to do Guide. Only about 90 of those 370 programs were considered an established program, meaning they were already doing a lot of the components that were required within Guide, but there was just no official way of paying for it. Some people were doing it by philanthropy, some people were doing it just as part of a large health system. So the established program started in July of 2024. And then the rest of the program started this summer in July of 2025. So as of now, October, all of the programs should be up and running or almost up and running.
That's great.
Yeah.
So it's fairly new. And so the one we have, is it just in our area here? Or are you saying those are across the nationwide, or?
Each guide program has its own geography.
Okay.
Partly because as part of guide, there actually is a required home visit for people who at least have a moderate tier of dementia. And by that means that they at least need some reminders or cueing for bathing or dressing. So they're beyond the point of, not being able to drive or manage their finances or manage their medications. And because of the home visit and the respite requirement, not very few programs can cover like a whole nation.
That makes sense.
And so for the program at Wake, we are covering Forsyth, Guilford, as east as Guilford, as west as want to say getting towards Boone,
Okay.
and then as north as towards Virginia, and then as south. We are overlapping with the Charlotte Atrium Guide program, like right around kind of Cabarrus County.
Okay.
So all of these are, you can actually look on the website for Guide, which I know you guys will link in the show notes, that there is an interactive map. You can see which guide programs are in your area or in your state, or even in the neighboring state, and contact them that's probably the best way to figure out whether or not you're covered. Medicare also have supposedly sent out a letter to patients who are eligible based on what
to learn how to utilize the program.
To contact the program, but as with all things coming from the government, sometimes people don't quite understand what they're getting in the mail, or they say, "Oh, this looks nice," but they don't.
Or they're getting an abundance of stuff at one time.
They
and
just don't look at it. Yeah.
Or it just sits on someone's kitchen counter for a while.
And so when you say respite, would it be something that like a family would be able to utilize? Say they're doing okay and then an emergency situation happens, they have to go out of town. Can they do overnight respite stays? Do you have contracts with places that do that?
So that's the part that will differ depending on which guide program you are. A lot of the guide programs are actually hospice organizations that are kind of expanding their dementia outreach to people who may not be quite eligible for hospice. And oftentimes hospices have inpatient hospice or residential beds that are available. The reimbursement rates for guide from Medicare, it's right now so low, and the amount of respite days that $2,500 can buy you is so limited that at least for the Atrium programs, we're not able to find a suitable facility that will take the rate at the level that Medicare requires. A lot of the respite,
And especially with the Alzheimer's.
right? A lot of the facilities for memory programs in the facility oftentimes have a minimum of 2 weeks or sometimes a month stay, which is way more than the cap. And so because of that reason, and the fact that Guide requires definitely in-home care, we offer in-home and adult day, but we do not offer facility-based care. But that may be different depending on where the listeners are and which specific guide program is in that area.
Yeah. So since you've been dealing with this and hands-on, have you seen some like success stories with families, or do you have like certain ones that stick out to you that where God really helped them, helped the loved one, helped the caregivers, and just made like a huge difference?
Yeah, absolutely. I think from the family's perspective, the patients who have been enrolled either have really appreciated the proactive and frequent contacts that our program have made to them. I mean, monthly basis, that's more frequent than you can get at most primary care doctor's office.
Yeah.
As well as the respite care. I think we had just heard from one family who said that when they started, they didn't quite realize how much they needed respite. They thought they were doing okay, but they decided,
that relief.
But they decided to use a couple hours of respite and quickly realized that it is a huge lifesaver. Even if it wasn't a whole day, it still allowed that primary caregiver to be able to go to her own doctor's
Yeah.
appointments without always having someone tag along with her, or just have a little bit of a mental break knowing that their loved one is safely cared for at home.
Mm-hmm.
And this is definitely something where I think the fact that this is a program that covers us an amount of respite funding, and families don't have to find that on their own, that coordination is already set up for them, makes it very easy. So for example, for families who are interested in respite for our program, we just say, okay, you're approved by Medicare, here are the choices of the in-home care agencies. If you don't have any preference, we'll send out the referral, and they'll contact you and say which day at what time would you like for us to start service. It is really that easy.
That's amazing, because as somebody that's not in the medical field and not familiar with that at all, I've seen it, my friends and other family members go through it. It's so overwhelming because you're trying to take care of your loved one, you're trying to do all the things, and then sometimes it's just like, okay, I'll worry about that later. We'll figure that out then. Or it's just so overwhelming, you don't even know where to start, so you get in that paralysis analysis, like where you just get stuck in the fear or don't want to.
Yeah.
Or afraid to like give pieces of the control out.
That too.
Like,
yeah.
You're like, they're not going to do it the way I want. They're not going to, but. Really,
or that guilt of, I'm supposed to be doing this. I shouldn't have to ask for help. And I think you've probably seen a lot of caregivers with that emotional struggle go through that too, I'm sure.
Absolutely.
Yeah.
So when do you think they begin, or how do people start to recognize that they need the help?
I think if they're noticing that they oftentimes feel overwhelmed, not just occasionally overwhelmed, but almost always feel overwhelmed, that sense of guilt. If we actually have validated questionnaires for caregivers that I ask our patients and families to fill out almost every time I see them, to actually screen for the degree of caregiving intensity.
Oh, that's good.
And that some of the questions that it's so predictable, where if I start asking, people start crying. That's usually a sign that they've been just holding so much in. And as soon as someone, especially a doctor, asks them, how are you doing? That's when the tears start flowing. And some of those questions are like, do you always feel like you don't have enough time to care for your loved one and your other responsibilities? Do you almost always feel guilty about what you should be doing more for your loved one? Do you almost always feel uncertain as to what you should be doing for your loved one? And then do you feel kind of tense and on edge more often than not because you are frustrated, overwhelmed, trying to do the best you can? All of those are typically signs that you need more help regardless of whether you admit it or not.
I think that's hard too for our generation. We talk about the sandwich generation and being kind of pulled in both directions too. Very spread very thin on that sandwich too. So I love those questions. I think I could see how sitting down across from somebody, and if you've been like stuffing that, and just have someone
opens
actually
it up like Pandora's box.
So
for me, and I know we were talking about this a little bit before the recording, and that I was a sandwich generation caregiver for my mom who had ovarian cancer. She has since passed, but when she was diagnosed and kind of shortly after, even as a physician who knew a lot about the medical system, I was finding myself really struggling at work, just being able to focus and pay attention, because a lot of my mental energy was thinking about her.
Of course.
Is she doing okay? She had an unexpected hospitalization around the time that I really recognized And for me, I knew that work was one of those red flags where if I'm not able to function, it probably means I've been pushing things down too long for too far. And I actually, and there's a lot of grief, I think, in caregiving that we don't talk about enough. Just a loss of either the person in front of you, of who they were, the type of role they played in your life, and maybe not able to play anymore. And then also for people who have family members who are very young. My mom was only 64 when she was diagnosed. So there was also the grief of the future that we weren't going to have.
Yeah.
And I think that for me was tremendously overwhelming. And I needed to have counseling for myself. And that has really been the thing that helped me be the best daughter and the best care partner for my mom. Our relationship was complicated for a number of reasons even before she got sick. And then after she got sick was when things really kind of escalated in many ways. So I think that going back to Guide and going back specifically for our Guide program at Wake is that our social workers are not only social workers who can connect you to resources, but they're licensed clinical social workers who are counselors.
Yes.
So they can actually counsel a caregiver who needs counseling.
That's great.
Because
I think that's the biggest
Yeah.
thing about
Right.
that. Yeah.
right,
Yeah.
because and maybe not have it be even described as counseling because
It's like
just
touching on a lot of things,
Yeah.
like
Right.
the whole program
Right.
impact beyond the client.
Right,
Like,
right.
spreads out.
And oftentimes this is something that's more for the caregiver than even the person living with dementia. Oftentimes, as long as the person with the disease is relatively happy and engaged, they might not even be aware of all the changes that are happening. Not to say that they don't have some insight, but after a certain degree, that insight is lost as part of the disease. And so it's really upon the caregiver who has to kind of hold on to that emotional weight and not being able to really talk to their spouse or parent or in a way that they used to be able to.
Yeah. So you kind of touched on before about that there is a website that people can go to. Is that so if listeners are hearing this and they're thinking this might be something I need to investigate, it would help our family a lot, what is the best way to get connected with Guide and find out if you qualify for it?
Yeah, so for the HVM programs, for just the Forsyth, Guilford area, I'll make sure to have this included in the show notes as well, but you can just email us, which is Guide, and it's AHWFB, because it stands for Atrium Health Wake Forest Baptist, at advocatehealth.org.
We'll make sure we get that in the show notes.
Because again, you don't need a referral. So if you think your loved one has dementia, they have traditional Medicare, and they kind of live in this vicinity, then they're eligible. But 99% of the time, we have approval from Medicare if those criteria are aligned. Only other small nuance is that if people cannot be in hospice, they can have palliative care, but they cannot be getting hospice because hospice provides a lot of the same services, at least in terms of respite. And then they cannot be part of a PACE program. I know there are some PACE programs around, particularly in Greensboro as well, and that they cannot be in a nursing home level of care. So independent living, assisted living are fine.
Including memory care and assisted living?
Yes, memory care gets a little bit tricky because most memory cares are actually considered assisted living to the state. And that as long as just because someone is in a facility, oftentimes it doesn't mean that the family isn't doing the caregiving. They might still be going every day, making sure things are okay, making sure.
I know a lot of people that would do the shopping. They would come, they would do the cleaning, especially like organization. Like I have seen people pack up everything in 20 minutes. and families have to comment to put it all back. That's like, you know,
Yeah.
the time to do all those things.
Yeah. So, so yes, if the respite is to help the unpaid caregiver in relieving their caregiving things. I don't know if a home care aide can really do some of the packing things, but they can certainly engage and keep an eye on the person living with dementia who might be in a facility and need that one-on-one care.
Well, yeah, especially if they're independent, they have their own apartment, and they just might need some extra
additional help.
Yeah, that's great to know that they can do that while they're in that community too.
Exactly.
Well,
it's just that the $2,500 cannot go toward their room and board.
Right.
It can go to supplement some of the time that the family would otherwise be spending there.
Okay. So you kind of touched about your past experience of being in the sandwich generation too, and you were talking about before the recording that you have your own podcast too. So tell us, before we wrap up, just kind of tell us a little bit about that too and what it's called, because I think we have a lot of the same crossover listeners.
Absolutely. So my podcast is called Ask Dr. Mia, Navigating Dementia Caregiving, and it's all about dementia, caregiving. And I have a variety of different formats. Sometimes it's me interviewing another expert. Sometimes it's just me talking about my personal experience and how, providing some education about some things that I commonly see and say over and over and over in clinic. And other times, there have been a few times where I actually provided some coaching to caregivers who are in the middle of caregiving, who needed some help, obviously not from a patient, physician relationship, but from an educational perspective, just to say, let's talk about the specific situation that you're in, and let's break it down in a way that I can provide resources that are generalizable to other people who are in your similar situation. So, for example, one was about a family who made a decision to move their loved one into a memory care, and that transition from home to memory care, which is oftentimes really challenging. So we talked about that. Another time it was a daughter-in-law talking about her relationship with her mother-in-law who has dementia, as well as her relationship with her husband, and
the dynamics
and they have young children. So I called that like a sandwich plus.
With some sides.
With some sides.
I hear all about that.
So I think if anyone who's listening who wants to even join me on my podcast, feel free to reach out. And happy to help and kind of make it helpful for other people who are listening as well.
Amazing. Thank you so much.
Thank you.
Really,
Thank you for having me.
I appreciate every moment of it.
You're such a great resource and a wealth of knowledge, and just like I said, I do have a really good friend. She's in the beginning stages of figuring all this out and trying to,
navigate it.
I think I'm actually going to text her when we get done.
That's
you need
why
to
we're
listen to this next episode, and here's her info.
Absolutely.
So,
and I think it's particularly challenging for people who have early onset of disease where they're super young, and a lot of the resources are really not quite fit. They might be appropriate for someone in their 70s and 80s and have retired, not for people who are still currently working. So those people, those families need help more than ever.
Yeah.
And it's also that, like you mentioned too, about it being early on. You kind of think, okay, they live long enough, we might have to deal with this down the road. You don't think about it happening in like late 50s or 60s, So just a whole new challenge there too.
And I think for those cases, it's also very important to have the right diagnosis, because that really opens up not only for treatment, which sometimes there may not be all that many good treatments, but it opens up things like power of attorney, setting up the decisions that need to be made, what kind of conversations do we need to have as a family while the person who may still be able to participate in those decisions can have. So there's a lot of financial and legal implications in getting the right diagnosis and getting it sooner rather than later. Not to go on a whole tangent, but sometimes people ask, like, what's the point of diagnosing people early if we don't necessarily have a cure? And I would say that people who say that probably have a very narrow view of what a treatment is. Maybe the medications we have are not great in terms of, changing the trajectory of the disease, but a good memory specialist really should be talking about safety related stuff, talking about how do we best support the family, how do we kind of provide
the best quality of life.
How do we provide guidance as to what may change over time? I mean, that's really what families need more than just a pill, which,
it's good.
Should happen, and it's coming. More and more are coming down the line, but there is absolutely a need to get the right diagnosis, even just from disability. You can't fill out a disability paperwork if you don't have a diagnosis.
Well, and like you said, all the legal, financial things to go ahead and make sure things are put in a trust, or someone has a POA, and that the loved one that has a diagnosis can have their say in how they would like things while they're still,
able
can
to
participate.
Yeah.
Exactly. I think that's huge too, instead of just putting our head in the sand and not wanting to
So
deal with it, which can be easier than for the moment, but in the long run, it just makes things so much more
harder.
Yeah.
Well, thank you again.
Thank you.
Thank you. It's been great. Thank you so much. All right. Thanks, y'all, for listening today, and we will see you next time on Mom, You're Grounded.
Thanks for joining us on this week's episode of Mom, You're Grounded. If you've laughed, cried, or learned something new, hit follow, leave us a review, and share it with your favorite sibling, friend, family, or even your mom. We'll see you next time.